Reading medical papers. New study. RIC helps stroke survivors walk further, feel less fatigued. Let's read a research paper together. The title of this paper is Remote Ischemic Conditioning for Fatigue After Stroke. RIC-FAST, a pilot randomized controlled trial. Hello everyone. Today we will discuss a common issue faced by many stroke survivors, post-stroke fatigue. Did you know that more than half of stroke patients experience persistent tiredness during their recovery? Rest often doesn't help, and this fatigue can even affect walking, rehabilitation, and overall quality of life. This condition is called post-stroke fatigue, PSF. Why is this important? Post-stroke fatigue is more than just feeling tired. It can reduce attention, lower motivation for rehabilitation, and even increase the risk of death and dependency. Currently, there are no effective medical treatments, so finding new strategies is crucial. What is RIC? Remote Ischemic Conditioning, RIC, involves using a blood pressure cuff on the arm, inflating it to 200 millimeters of mercury to temporarily block blood flow for 5 minutes, then deflating it for 5 minutes. This cycle is repeated 4 times, taking about 40 minutes in total. This brief period of ischemia followed by reperfusion activates the body's protective mechanisms, improving blood flow and energy metabolism. Researchers believe this might help reduce fatigue after stroke. How was the study conducted? This was a randomized controlled trial in the UK with 24 stroke patients suffering from severe fatigue. They were divided into 2 groups. RIC group, cuff inflated to 200 millimeters of mercury. Sham treatment group, cuff inflated only to 20 millimeters of mercury. The treatment was done 3 times a week for 6 weeks. Measurements included safety, acceptability, fatigue levels, using the FSS 7 scale, walking distance, 6-minute walk test, cardiopulmonary function, and muscle energy, ADP levels. Research findings. Safety. RIC showed no serious side effects, only minor issues such as slight skin redness, headaches, or arm swelling, with most participants reporting only mild discomfort. Acceptance. Over 90% of patients completed all treatment sessions, indicating excellent compliance. Fatigue improvement. The fatigue scores in the RIC group decreased more than those in the placebo group by about 0.7 to 1 point. Although this difference was not statistically significant, the trend was clear. Walking ability. The RIC group's average walking distance increased by 28 meters, while the placebo group's distance actually decreased. Muscle energy, ADP in the RIC group. ADP levels in the affected leg muscles increased, whereas they decreased in the placebo group. This suggests that RIC may improve cellular energy metabolism. Significance of the study. This is the first time RIC has been used to treat post-stroke fatigue. The results indicate that RIC is safe, feasible, and potentially effective in reducing fatigue, improving walking ability, and enhancing muscle energy. Although the sample size is still small and larger studies are needed, this represents a very promising new approach. Summary. Post-stroke fatigue is common, yet effective treatments are lacking. RIC is a simple and safe method that can be performed using just a blood pressure cuff. Preliminary research suggests it may help alleviate fatigue, improve walking capacity, and boost muscle energy. If future studies confirm these findings, RIC could become a valuable tool in stroke rehabilitation. In other words, you can think of RIC as an energy charger for blood vessels and muscles. Although it involves only simple inflation and deflation of a cuff, it might truly help stroke patients regain strength, walk farther, and live better. Isn't that something to look forward to? Do people truly believe that healthy medicine and RIC can promote wellness? Hurry and purchase a healthy RIC sphygmomanometer to enhance your health every day. Don't forget to scan the QR code. Thank you all for watching. I am Dr. Andrew Shu Lee. Until next time.